Welcome to another episode of Get Connected with LU. This is your host, Patrick Frewa, and with me today is Dr. Richard Sedgwick. Richard, how are you?
Hi, I'm good, Patrick. How are you doing?
Good. So Richard is a family physician and also one of my closest friends. So this episode is going to be a little bit more informal, but hopefully it'll be just as educational. And the topic for today is low blood pressure. Correct. You heard correct. It's low blood pressure. All right. So, Richard, just for our viewers who have not heard from you before, maybe you can give us a little bit of a background on yourself, your experience, and how come you know so much about blood pressure and low blood pressure in particular.
Sure. So basically, I'm a family medicine consultant. I've got about 20 years of medical experience and family medicine for at least 11, 12 years now. I work here in the UAE. And basically, blood pressure-wise, it's a typical problem that people come into. Now, often people think of high blood pressure being the major issue, but low blood pressure is actually often more symptomatic, and therefore people will come in with symptoms, not realizing that it's related to low blood pressure. So it's a significant problem, and I will see it a few times a week with patients who are coming in.
Yeah, so you know this well because obviously you've taken care of me and my family, but I am not a low blood pressure. I am a high blood pressure person. So this is different in that, as you said, one of the main issues is with high blood pressure, at least from my side, it's known as the silent killer because you don't have as many symptoms. Yet with low blood pressure, it seems that there are quite a few symptoms that we can go through, right? So,
yeah, absolutely.
All right. Yeah. So let's start off with the first question, which is, what is the definition of low blood pressure?
Okay, so I think it's important also to realize what normal pressure is, normal blood pressure. So you're basically looking at a blood pressure between 90/60 to 120/80 is your normal range of blood pressure. It does vary a little bit between the sexes, but that's what you're looking at for a normal, healthy blood pressure. Anything outside of those things are either classed as elevated or, in our case today, low blood pressure. So that's below 90/60.
Right. So when you're talking about 90/60, 120/80, that's systolic and diastolic.
That's right, yeah.
Right. So what's systolic? What's diastolic? Because I know the names, but I don't necessarily what they mean in terms of how they pump to the heart.
Sure. So basically
I do know. I'm just making sure that you guys know.
So the first number, the bigger number, is your systolic blood pressure, as you said, and this is the pressure as your heart beats. So it's as it forces the blood out of your heart into your main artery or aorta and pushes it around your body. So as that impulse happens, that's the maximal pressure it reaches. Okay, so that's the first reading. The second reading is the diastolic pressure. And this is as your heart relaxes and the large chamber of your heart refills, ready for the next pump. And so that's the lowest pressure it kind of sits at in your arteries. So you end up then with these two numbers, and this gives you your blood pressure.
Okay. So is one more important than the other, or do they have to be taken in tandem?
Well, a lot of people concentrate on the systolic more, although actually they both are important and have different meanings if they are high or low. So there's some complexity around that. The diastolic can be very important when it comes to someone who is sick and in hospital. But normally in a fairly healthy person, you're more concentrating on the systolic.
Okay, fantastic. Yeah. Now, so how do you measure blood pressure in general? And what's the name of that infernal machine?
The sphygmanometer.
Say it again. One more.
I knew you were going to say this. The sphygmanometer.
He's been making me practice it all day.
And then I get it wrong.
Yeah, awesome. The stigmanometer.
Yeah, that's the one.
Okay,
so
excellent.
We'll just call it the blood pressure machine.
Yes, the blood pressure machine.
Okay. So everyone has seen the cuffs that you put onto your arm. Your arm is the best place to take it, ideally. It can be taken from other parts. Some have wrist monitors. You can even in hospital take it from the ankle. they're not as accurate. This is the place that you want to really take it in the upper arm. Which side you can choose, but try and stick to the same side. But it is quite actually helpful if you're just starting to take your own blood pressure is to try it out on both arms. And you want them roughly to be the same.
Right.
And in fact, if there's a big difference, that can indicate a problem, and you should flag that to your doctor.
Actually, Richard, that's a question that I do have, in that when I do take my blood pressure on the right-hand side, it's always lower than on the left.
Okay.
Is there a reason for that? And which one should I be taking? Because I obviously go for the right one because I like the numbers more. But is that the right thing to do?
It's not really. You should be looking at the one that's higher when you're monitoring your blood pressure for high blood pressure.
Okay.
And look at the one that's lower for the one if you're monitoring your low blood pressure.
Okay.
The reason for that is you want to know what the
most conservative number is.
Yeah, in both situations. But
I hear you, but I'm not going to listen.
Well, true, yeah. That's on many things, Patrick. But the point being that...
Like I said, ladies and gentlemen, this was not going to go as educational as you expected, but hopefully it is. You'll still get something out of it.
But the point is that there will be a little bit of variability between your right and left, because if you're right-handed, you're left-handed, the muscle of your arm actually can affect it. The size of your artery can also affect that. But if you're fairly even in balance of muscles, then normally you'll have a roughly the same blood pressure. The point I made earlier is if it is drastically different, in fact, if it is more than 20 millimeters of mercury, either the systolic or the diastolic, and that's consistent, that it's always that amount, then that's something that really should be flagged to your doctor. Just it can be a signal that there is something else going on between. So where the blood comes out into your main artery, it then goes mainly into your left side, but a branch goes off onto your right side. Okay, and there can be, if there's a significant difference, as I said, it needs to be flagged up just to check that area.
Okay.
It could be nothing, but it's just a case of making sure.
We'll go with nothing.
Yeah.
All right. Excellent. All right. So what are now let's get into the heat of it. So what are the symptoms of low blood pressure?
I've not actually told you how to take your blood pressure yet, but we'll go back to that.
Okay, let's go back to that. All right. So
that's just saying about which arm to test. We got off topic there.
Yeah.
So again, once you're happy, stick to one arm. Okay. Once you know that there's a little bit of variability, stick to one arm. To put it on, basically, you want to be not exercising for at least, I'd say 30 minutes if you've done exercise. Leave it 30 minutes before you check your blood pressure. You want to be sitting. You want to be fairly upright to 45 degrees in as far as your angle of your sitting. And you need ideally to have your arm at your heart height, so sort of mid-chest height. You need your arm to be there and resting on something, not just you holding it there.
Right.
You need to actually rest it like on a table like this, and then you put the cuff on, follow the instructions of your machine to where you position the cuff, because they normally have a little marker that's where you put it right in the middle of your arm here, which is where your major artery is.
Okay.
And then you put the cuff on, and basically then to do that, so not exercise for 30 minutes and just relax before you do it, basically sitting in that position.
Morning, day, night?
You should vary the times that you do it. If you're suffering with high blood pressure, you should always check that first thing in the morning. But we're talking about low blood pressure today, and that basically I would do it, if you're just monitoring, I would do it at least once a day if you can. If you are having symptoms, which we'll go into in a bit later, what those symptoms might be, but if you are having symptoms, I would do it at the time you're having symptoms, because you want to see what that blood pressure is. Obviously, make sure that you record it properly, because going to your doctor with just random numbers, it's better if you record it down either on old school paper or use Excel, or you use even these medical apps.
So thanks for that, because this is a great segue into the LU app and all of the wonderful things that it can do. I'm just kidding. This is not about the LU app. We can talk about that in another episode, or in the comments below. We'll leave you some information. We do track health and wellness vitals. But like I said, today is more about low blood pressure. So we'll just stick to the topic at hand. Okay, what about symptoms of low blood pressure? So what are these symptoms? Because as I said at the beginning, high blood pressure is the silent killer because you don't get any symptoms. I think the maximum that I've had when I was really at the height of it was would have a massive headache in the morning, or what I thought was a headache, as opposed to or throbbing in my skull. But when it comes to low blood pressure, it's a whole gamut.
Yeah, exactly. I mean, high blood pressure, you can get headaches and things, but that's when it's getting quite severe and quite high. The moderate levels, you don't often get symptoms at all. Mm-hmm. So with low blood pressure, symptoms come quite quickly, especially if your body's not used to the low blood pressure. If it's not something that's been going on for a long time. And the first kind of symptom that you'll probably get is things like feeling dizzy. So if you get up too quickly, you might feel like you're gonna fall over because you're off balance and you're feeling like the room's spinning. And this is often the most common sort of first symptom. Ironically, though, you can get headaches with low blood pressure because it's almost like your brain is complaining that you don't have enough blood volume going to the brain, and it sends pain signals. So that can be a symptom, but it's one of many.
Of many.
Yeah. So following on from dizziness being the first one, the worst dizziness you can get is actually passing out and fainting. And many of my patients actually that occurs to because your body basically, you need the blood volume and the oxygen to get to your brain. Your brain is the organ that is the most important as far as if you don't have oxygen there, receiving oxygen for even the shortest period of time, it affects the brain the most, okay? Other organs can cope a little bit longer than the brain.
So are you saying that the reason why you faint is because your body's telling you to get into a state where you can get blood to the brain? So yeah, oxygen to the brain? Yeah,
basically it's a natural mechanism, a natural defensive mechanism to get you on the floor. And therefore horizontal, because then what blood pressure you have is going to get to the brain easier. It's not fighting against gravity.
Right.
Okay. So the body has these great mechanisms. It knows.
It's a machine.
Yeah.
The body is really a perfect machine.
Knows what it needs.
Yeah.
So you faint, but unfortunately in that fainting process, you can also have problems. You can injure yourself because
sure.
You can pass out and hit your head, or you can, some people fall on something and fracture their ribs in this scenario. And even worse, this can happen to people not just from getting up. It can happen at any time, like if you're driving, and obviously that's a big problem.
Yeah, for sure. Mm. So we've covered fainting, we've covered dizziness. Mm-hmm. What other symptoms do you have?
So chronic low blood pressure as well can start to affect your cognitive function. So your memory and things like that can sometimes be affected. You can feel like things are not quite right, and you can feel forgetful. Obviously, there's multiple causes for many of these symptoms. They're not just purely low blood pressure, but it can be a soft sign. And so obviously to get yourself checked out if that was the case. The other things are related to, and that includes things like concentration.
Yeah.
If you are losing concentration a lot, you're feeling fatigued. This can also be a soft sign that there's a blood pressure issue.
So if you're constantly feeling tired, low energy, lack of concentration, so, I know we're going to talk about this later on, but that could also be an effect of someone who's on high blood pressure on someone who's on blood pressure pills to reduce their blood pressure. And then, they have a lifestyle change and all of a sudden the pills are too strong, right? So now you start to have that opposite effect where the pills are pushing down what's more normal blood pressure into a low blood pressure state, right?
Yeah.
Because I remember at one point after I lost weight, I was on very high blood pressure pills, never changed them, and then all of a sudden I found myself getting up, getting dizzy, feeling a bit nauseous. Lack of concentration, not so much, but definitely the fatigue, right? And then when I went to see my cardiologist, we just cut the pills in half and then in half again, right? Just to amend that new altered state.
Yeah, absolutely, yeah. when you are on blood pressure medication for high blood pressure, and then things change, and that can be for detrimental effects. So your blood pressure can go even higher. So you might need to increase the dose. But as you said, if you do change lifestyle, whether it's exercise, whether it's losing weight, whether it's change of diet, that can drastically alter. These are all things that can affect blood pressure, and it can affect people who have high blood pressure. But if you have low blood pressure, if you do the same things, it's going to make your blood pressure even lower.
Which is one of those things that, in my view, this is why you always have to constantly monitor your blood pressure. It is a pain in the butt to do it every day and not to forget, and to set yourself with reminders, and to sit down and to take that 2 minutes in the morning before you have a coffee, when all you want is a coffee, right? But this is important because it is that constant monitoring that gives you that advanced warning signal before, things get a bit hairy. So,
well, it's about getting into a routine with different things. You've gone to make that coffee as a routine.
Yeah.
Okay. Why not put the coffee on and sit down at the breakfast table and take
Richard,
your blood pressure?
Making a coffee is a fun routine. Finding out that your blood pressure is not where you want it to be is not so much fun.
True.
So, all right. So, what leads to the symptoms of low blood pressure?
So there's a demographic really that is the most susceptible to this, and that is females between the age of 20 to 60, who often will run a low blood pressure, much more so than males through that age group. But it's not impossible to have it in a male, and in fact, it's more significant in a male. If you've got a male with low blood pressure, then really you've got to be checked out and make sure that it's not something pathological or significant. So, but with the females, so it's the group is there, and there's some underlying reasons for that. Not only genetics and the way that a female body is built, but there's also things like you have more females who have things like thyroid problems and hormonal problems. Or hormonal differences. I shouldn't really say problems, but imbalances, yeah. Which basically does make them more susceptible to things like low blood pressure, and so all of that needs to be considered when you're looking for causes. So a hormonal screen is essential if you're going to your doctor. Either you have low blood pressure and you've gone with readings, or you're gone with symptoms and the doctor measures your blood pressure and it's low, and they say a lot of these symptoms are related to that. Then investigation-wise, you've got to be looking at these causes.
So hormonal imbalances will definitely affect your low blood pressure. Is there anything else that would, like any other physiological impact?
Of course, yeah. So you're going to be looking at things like anything to do with the heart, okay, can have a big impact on your blood pressure. So things like, which we didn't cover, but symptoms like palpitations or fast heart rate could be related to the fact that you have low blood pressure, or it could be a causation. So to have a look at that, they would do an ECG. So when you're looking at it, a lot of these symptoms are related to the fact that you have a low blood pressure because of blood flow to that organ, and therefore it affects symptoms. So all these ones to do with the brain, the dizziness, the fainting, the concentration, the fatigue, is all to do with the lack of blood flow to the brain, or the lower pressure of the blood flow to the brain. Therefore, it's not getting enough oxygen to work at its optimum. So when you drop that blood pressure, you'll have those symptoms. Right. So that's one of the physiological effects. It's the same with things like your kidneys need a good flow of blood to function properly. If you have a low blood pressure, your kidneys won't necessarily function as well. And you'll have other symptoms related to that, including things like the nausea and things like that. So those are the some of the physiological. The other thing is the fact that if you have low blood pressure, your body again has a feedback mechanism to your heart to speed up the heart, so it pumps more. So
is that where those palpitations come into play?
So you get palpitations, you get a fast heart rate.
I feel like I passed an exam here.
Yeah, you're doing well.
I'm doing all right. I've been a lifelong learner of blood pressure, unfortunately.
And basically, so the heart reacts. There are nervous reasons for that, as in nerve impulses, and there are chemical reasons for that. But basically, it'll both lead to the same thing, that your heart is going to speed up, and occasionally, if it's sped up too much, it's going to become irregular, and you're going to get those palpitations where you feel heartbeats miss, or you have extra heartbeats in there, and so those are things that people pick up very easily. The other thing to say is one of those chemicals is adrenaline, and so your adrenaline can peak to keep your heart rate fast, to keep that blood pressure up. And that's part of your fight or flight response. So when you are in danger or running, you'll notice your heart rate goes up, your adrenaline shoots up, you're all on edge. This is an effect.
So what would happen at that point? Once you come off of that high, that adrenaline high, does that mean that your blood pressure will automatically dip, or like how does that work exactly?
Well, in that scenario, the fight or flight, yes, your blood pressure will go up as your heart rate increases, but you're going to be using that blood pressure. So if you're running from something because you're the flight part, then you're going to be using muscles. If you are fighting, you're using muscles. So the blood is flowing to those muscles to get oxygen to those muscles, get more oxygen to your brain so you can think of how to escape this dangerous situation. Innate historical reaction from the body to escape danger. But unfortunately, when your blood pressure is low, it has a similar impact where your adrenaline can be high because it's constantly trying to get your heart to push out more volume and increase your blood pressure.
Overcompensating.
Yeah, it's when you're not in that situation, it's just trying to get your blood pressure higher. It's a biomechanism, but it's there.
So we've covered off some of the symptoms of low blood pressure. Are there any other symptoms?
So other symptoms include things like when you're having that dizziness, you can often be nauseous. There can be many mechanisms involved in that, but nausea is often a common symptom that comes and discussed with patients. The other things are things like visual changes. So you might get blurred vision, tunnel vision, seeing flashes of light sometimes if your blood pressure suddenly drops, and so those are important. The other things is because of the reaction to your low blood pressure sometimes can be a cause as well as your heart rate. So you can get things like palpitations. Now that can be as a result of low blood pressure. It can actually, as we'll talk about later, be a cause of it. But that's where your heart beats slightly irregular. You might have extra beat, you might have a missing beat, but you can often feel that, and patients who are not used to it will say, I missed a beat there, And that goes along with the heart rate. Your heart rate itself will be much faster if your body is not used to a low blood pressure.
It'll just keep pumping so that it can kind of regulate itself,
it's
right?
It's trying to basically get your blood pressure normalized through various feedback mechanisms from sensors in the body of your blood pressure. It will try and speed that heart rate up to make the blood pressure higher. So each pump, you've got a volume of blood coming out, and if you speed up the number of those pumps, you're going to have a higher pressure, and that's in any mechanical system, let alone in the body. So what the heart's trying to do is feed that back. Now there's two mechanisms it does. There's sensors in your big arteries here going up to your brain, and they pick up if you have a drop in blood pressure, and they feed back to your heart to make it beat faster. And then you have other mechanisms to do with hormones like adrenaline, and that's part of your fight or flight response. So if you are in danger, you'll often notice that your heart rate will really speed up and your attention will pick up, and this is your adrenaline flowing, and that's to get blood flow to your muscles and your brain to either fight or as it says, fly. So to run away. So this also occurs in some degree when you have a low blood pressure, especially in someone who doesn't have a normally low blood pressure. And this is a sudden change. So those are the kind of symptoms you're going to feel, basically.
Okay, yeah. And that goes back to the original point, which is there's a lot more symptoms in low blood pressure than you would find in high blood pressure.
Sure.
So we didn't talk about it before, but let's just catch up on it now. So I know that high blood pressure is hypertension, low blood pressure is
hypo.
So hyper.
Yeah.
Is that right?
So I always hypo, low. So use the O in hypo to have low, and hyper is elevated with an E. So that's how I often tell people to remember.
Okay, awesome. Well, either way, you know that whether it's hypo or hyper, the symptoms are much more front-loaded towards the hypo than the hyper, right? Sure. And what are some of the causes of low blood pressure? Now, we've talked about the symptoms. But what about the causes themselves? Like what would lead to low blood pressure, which is, very, very different from high?
Sure. So as I said before, females are much more prone to having the low blood pressure problem. And that can be normal for them up to a certain point. As I say, if it's at the lower end of the normal, let's say, so between 90 to 100, systolic, that's often the case in a female, a normal, healthy female coming to me with that blood pressure with no symptoms, that can be their normal. It's not a big problem. If it's a sudden change, they're normally higher than that, and they've suddenly dropped to that.
Sorry to interrupt, but you bring up a very good point here. Without data, and again, we're probably speaking a lot more about the value add here, but let's keep that out. But without data, how would you know that someone is at that moment in time hypo, hyper, or normal? Because if I go and I see my cardiologist with 120/80, I'm fine based off of, my situation. But if my wife was to follow through with 120/80, because she is more of a hypo than a hyper or normal, at 120/80, she's probably at higher risk than I am, if I'm not mistaken.
Well, something's not right. So if she normally runs, let's say 95 systolic, and then suddenly she's 120, something's changed. And the only way you know that is by knowing what your normal is.
Right.
And if she's
So track your data, guys. I mean, this is probably one of the biggest messages that I would like to convey here. Not only get educated around blood pressure, but track that data, because if you don't track that data, you don't know what the benchmark is, right? Sure. So you don't know what your standard is, and so coming to see you, I would assume you would ask the question. So what do the question would normally be? So what is your normal blood pressure, right?
Yeah, exactly. If you haven't got a long-term relationship with that doctor, they may not have those facts. They may not have that data. And as we know, you go to your doctors, sometimes that can raise your stress level and anxiety level. So actually your blood pressure can sometimes be higher in the doctor's office than it is because of those factors I pointed out before. The adrenaline is running a bit high.
So the trend is your friend.
Yeah. So looking at your home readings is much better than just looking at those very intermittent doctor's office visits every 3 months, because you may have a false sense of security that if you are suffering with symptoms of low blood pressure, your blood pressure might be normal when you go to the doctor's office, and they don't even consider low blood pressure as a reason for your problem. You go home and suddenly it's 80 systolic because you're relaxed in your normal environment. You've got your answer. So doing your home checks, keeping the records is definitely a good point.
So basically, you are a big cause of a lot of people's stress.
Yeah, in certain circumstances, for sure.
All right.
Unfortunately.
Well, I don't know if it's you or the lab or the lab coat that did the white coat. Excuse me. I don't know if it's you or the white coat, but.
Well, it's even called white coat hypertension.
Oh, is it really?
It's an actual known problem that people can sometimes be labeled as having high blood pressure, get treated, and actually they get these symptoms of low blood pressure because.
Oh my God! Reason. Because they came to see Richard and any other doctor.
Well,
all right. So going back to some of the causes of low blood pressure, as you were saying.
Yeah, so with the female population, they are genetically more likely to have it, but there are some things that go alongside that and reasons because of things like hormonal imbalances. So you're looking at women are much more likely to have thyroid problems prevalent, and therefore a lot of the thyroid problems can cause lower blood pressure.
So there are some temporary causes.
Yeah.
Right. So could you give us an idea of what those are?
So it goes from the basic things like when you stand up suddenly from sitting, you have something called orthostatic hypotension, and this is where you feel dizzy for that few seconds after standing. Your blood pressure will have dropped, and until your heart catches up, your blood pressure can be on the low side and give you those dizzy symptoms, occasionally passing out.
Okay.
Other things like dehydration. So really important to keep your blood volume high, or at the normal level anyway, to maintain your blood pressure. If you're very dehydrated, you will really struggle to have a normal blood pressure. So hydration is key. If you've done a lot of exercise, if you've been out in the heat, increase the amount that you would normally drink to keep that hydration. There are obviously very obvious causes, like if you have had an accident and you've had some trauma, you might have severed an artery or something, you might have acute blood loss, what they call acute blood loss. And that's obviously dropping your volume very quickly. Now that's an emergency, and obviously you would get yourself to the hospital or call paramedics or things. So you can see that. But if you've had a major surgery, also you'll have lost some blood volume as well, as depending on what surgery and things. So that also can lead to low blood pressure along with the effects of the anesthetic and things. So you may well have a low blood pressure after surgery.
What about infections? Are there any infections out there that would reduce? I know that there are infections that, or normally when I have an infection, such as a flu, a cold, or whatever virus, or if it's bronchitis, I notice that my blood pressure goes up. But are there any infections that would cause the opposite effect of a low blood pressure?
So in the early stages of a mild infection, shall we say, yes, your blood pressure can go up a bit because your body, again, has those defense mechanisms that is trying to pump more blood and oxygen around to get rid of that infection. So you might find your blood pressure goes up in that time. But if you have a long-term infection, or then it becomes more severe where your actual blood starts to get infected, it can lead to something which people are becoming more aware of called sepsis. And this is where you become septic. And this is a whole different ballgame as far as infection is. It's the most severe form of infection.
Okay.
And your blood pressure can severely crash at that stage.
So it's at that point that you're not going to see your doctor. You'll
either be already a hospital patient or you will be going to the emergency room for sure.
Right.
And it's a case of having more awareness with sepsis because I've seen sepsis in people who have had a dental abscess for a couple of days to a week.
Yeah.
They're on oral antibiotics, but it's getting worse. They're feeling more and more unwell. Don't just think, the antibiotics will kick in. Make sure you're checked out because these are important scenarios.
You know what? That's an excellent point because we know from our environment and we're both in various aspects or different aspects of healthcare. We know that when it comes to getting people to get up and move to deal with whatever issues around their health, they are always. I'll speak for myself at least. I always treat going to the hospital, going to the clinic as kind of like that last thing that I need to do. I really don't want to deal with it. Coming from Canada, great healthcare system, but the wait times are crazy long, right? Living in the Middle East where it's more of a private healthcare. Yes, I do go through the healthcare system, but I don't want to get up and actually go through the whole process of getting the test done and all of that. So sometimes the lack of initiative could actually, make things worse. And I think here, the most important thing is if you see that there's something wrong, get up, go see your doctor, go to the clinic, go to the hospital, whatever you feel is necessary. Again, we're not talking about diagnosis and consultations on this episode. This is for general information purposes. But the important part here is listen to your body. I think from what you're saying here, it's listen to your body and make sure that you take appropriate action, but timely appropriate action.
Yeah, no, I totally agree with that. I mean, it's expanding the topic, but sepsis itself is another topic. But general looking after yourself and doing things early, it's much better to prevent than to have a problem and have to go back on it. It's not fighting fires; it's stopping the fire starting in the first place.
Right.
So prevention is key. I'd tell you this in any medical blog that we do. It's a case of seeing patterns, knowing yourself, listening to your body, as I say, and not being apathetic about it. Because us men are the worst. I feel, certainly in my experience. We've
been talking to my wife.
Yeah, basically, yeah. But we and even us doctors.
But if you're going to do something, be the best at it. So I'm the best of the worst.
Yeah. But then you met me, so we've got you sorted, and things are going giggity-boo now.
So I'm just average now.
Yeah. But yeah, no, us men are particularly bad at that. And although this topic today is not particularly aimed at men because it's rare, but it's a case of if you have issues, you get them sorted out quicker. You don't have this long-term problem, so don't bury your head in the sand.
Yeah. So, okay, now, so that covers some of our temporary issues. What about lifestyle factors? Are there any lifestyle factors that could cause low blood pressure?
Sure. So these can be temporary as well. So such as things like if you lost a lot of weight suddenly, we mentioned it earlier as a causation of the symptoms. And we didn't really go into it, but if you lose a lot of weight, you're losing a lot of body volume, and therefore you've got less body volume to pump that blood round, and so therefore your heart is used to you having a big body volume, and so it will slow right down and pump less, and that can lead then to low blood pressure. The other thing, this is especially if you've lost weight very quickly, whether you've had weight loss surgery, bariatric surgery, or you've had been using weight loss medication. The other thing to factor into that, which again we touched on before, is often if you were overweight and you've lost this weight quickly, when you were overweight, you may have been hypertensive. You may have had high blood pressure,
right?
Been on blood pressure medication. You've then lost that weight over a very rapid time, but you're still taking the same doses of your high blood pressure medication.
Which is what we were talking about earlier. For me, I was in exactly that situation. Hyper due to heavy carrying a lot of weight. And then I normalized my weight. I lost a lot of weight quickly. Not necessarily out of my own accord, but I lost a lot of weight quickly, and then I became all of a sudden in that hypo state. But that was temporary because once we reduced the blood pressure pills, as I said before, that regulated. But in the meantime, I did suffer those symptoms, right? Like I said before, getting up quickly, I would all of a sudden feel dizzy, and I'd have to take 2 to 3 seconds just to kind of balance myself.
Yeah. So those are big factors. If you alongside that weight loss, which you did, you increased your physical activity. This also can either lead to weight loss or just lead to better blood pressure control. So you've also got that to factor in if you've suddenly increased your physical activity.
So what happens when you increase your well, that's a very interesting thing because especially for when it comes to low blood pressure. Increasing your physical activity, that's kind of what we're all told to do.
Yeah.
So how is it that affects low blood pressure? Is it that we can go to the extreme, which is something I can't fathom, but is it, I'm spending too much time at the gym, or is it the intensity of my workout is too much? Or am I not taking enough breaks? Or is it all of it?
So it depends really where you're starting at. If you're starting at you have normal blood pressure and you increase your activity, your blood pressure will generally lower over time. Okay,
which is what we want.
All right, it could end up being too low if it's where you start to feel symptoms possibly.
Okay,
if you Definitely, if you overdo it from being in the normal blood pressure and you are over exercising and it's not what your body's used to, you will definitely end up with a low blood pressure.
I've always been worried about over exercising, so I just didn't do it.
Exactly. If you start with a low blood pressure and you increase your exercise, again, it's going to get, majority of cases, it's going to get lower over time. When you're actually exercising, your blood pressure will go up. I'm not saying it's when you exercise, it's the longer term
effect. It's the longer term effect, okay.
And then if you start with high blood pressure, again, while you're exercising, your blood pressure might go up even higher. But over time, your trend will then aim to normality and you will end up with a better blood pressure and maybe avoiding blood pressure meds. But if in any of these scenarios, if you overexert yourself, if you overdo it and your body's not used to it, you can end up in that low situation.
Okay, so just to recap on that point, because I know, first of all, on this channel, on a lot of other health and wellness channels, we're always talking about lose weight, increase your physical activity, ensure that your body and mind are aligned. Here, what you're saying is you're not saying don't exercise to lower your blood pressure. What you're saying is make sure that you don't go to that extreme state in your physical activity where you overdo it. And by overdoing it, you lower your blood pressure to a point where it could be an issue. Is that right?
Yeah, absolutely. Yeah. Okay. It's about moderation. It's about building up slowly to those zones, not doing things suddenly. Your body doesn't like sudden changes. It can't react quick enough.
Very good point.
In many ways.
Yeah.
It needs a little bit of time to get used to things. In the same way, you move to a hot country, your body takes time to acclimatize to that hot country, or you go to a cold climate, your body takes time to acclimatize.
Right.
Sometimes it never does. Some people don't have that ability.
Love Canada, hate my weather.
So, but it's just a case of the body takes a bit of time.
Okay.
So what I'm saying is when you do sudden changes as described by these lifestyle factors, the weight loss, the sudden increase, especially to extreme levels of exercise, even dietary changes. If you drastically change your diet, you cut out all salt, you lower the protein levels and things like this, this is going to end up lowering your blood pressure. And this is why when you have high blood pressure, we say you must reduce your sodium salt in your diet. This is an important factor, but if you're on the low end and you do that, you're going to end up with lower blood pressure and more symptoms.
Okay. What about, we've covered, a lot of what we've covered is lifestyle changes, temporary causes. Is there any chronic hypotension causes?
So we touched on like acute heart problems, but long-term heart problems themselves. So if you are often slightly middle-aged and older, you might have some heart conditions which are long-term, and these might not be able to be. They can be modified with lifestyle changes and various treatments, but you might always have a low blood pressure if you're heading down the heart failure route where the pump is not pumping very well. There may be no way that you can get your blood pressure higher.
Yeah.
There are also other long-term endocrine issues which you might not be able to.
Thyroid issues, right?
Yeah, I mean it's a case of if it's treated properly, then it can be a long-term temporary, shall we say. So but when we say long-term, it doesn't mean it's definitely not treatable, but it means that it's not something that you can necessarily do on your own.
Right.
And you might need medication, you might need treatment for that heart failure in order to get your blood pressure better. So that's what we mean by a longer-term problem.
Which is actually a very good segue into, are there any medications or supplements that can cause lower blood pressure?
So many medications which people don't realize sometimes will lower your blood pressure. So some of the mental health medications can lower your blood pressure. Obviously, we've mentioned blood pressure medication. So you had high blood pressure, that's going to have an effect.
Really?
And things like diuretics, especially because they dehydrate you if you're not hydrating well enough, because it's what you'll commonly know as water tablets. And you pass a lot more water, a lot more urine. So these are all ones that can help, but other drugs can affect how your heart beats as well, can affect things like your sodium, potassium levels in your blood. So there's a full list of drugs that the doctor will be aware of, the main culprits.
Okay.
That if you went with symptoms of low blood pressure, you'd want to see a list of your meds,
I mean, God rest his soul, but with my father, at the end, he was on so many pills that some of those pills were just there to counteract the side effects of other pills. That they had no other
options. Yeah.
They had no other. What's the word I want to say? They had no other
justification. Maybe.
Yeah. They had no other justification to be taken other than just to lower the side effects from the other pills he was taking.
Yeah.
So in this case, it's the whole point, I think, is to lead a lifestyle where you can try to minimize your medication as much as you can, because you don't want to get into that state where you're taking a look at all of those meds and, oh, this is lowering my blood pressure, this is increasing this is lowering that, this is increasing that. Nothing in life is free, right?
Yeah.
So, but a lot of people say that they want to get off of meds or not take meds, and then will take supplements. And you and I have actually done quite a few investigations around the different types of supplements out there. What advice do you have to people regarding supplements in terms of low blood pressure, or the cause? Are there supplements that could cause low blood pressure? So we're not here to give you guys a list of what's good, what's not, but I'd just like to hear your opinion around supplements in general.
Yeah, I mean, on the whole, for supplements, there can be some very good uses for supplements, and it's a case of the supplements aren't tested in the same way that medications are. So you don't go through that strict regulation and those strict clinical trials, which to get a prescribable medication to the market, you have to go through, and the authorities in each country that are the jurisdiction and the people that hold that power as to whether to grant a medication or not. Supplements are seen as more food additives, should we say, and they're much more along the lines of the food industry, and therefore they don't go through the same testing to prove that they do what they say on the tin.
Sure.
To check their side effects, to check the things that could go wrong by taking those and having high levels of those supplements in your body. So there are some excellent ones which have a lot of benefit, and there are certainly the more common and well-used ones. There is some evidence-based that they help in certain scenarios, but it's about doing your own homework. It's about making that judgment, and always include any supplements you're taking in the meds list that you have. So if you're going to see a doctor and you go in and he says what medications you're on, you must include the supplements you're taking because of these reasons. One of those supplements might be causing your problem, whether it be low blood pressure, whether it be other issues that we discussed.
Right.
You must include it in the list of things that you are taking.
Right. So don't just stick to the meds because you assume that the doctor would only know that.
Yeah.
They would also know if there's any sort of side effects from the supplements themselves.
And if they don't know, because there are thousands, it's about knowing it, and they may have to go and read about it and check.
Sure.
And this is often the case. The patient will come in with a very...
We do put a lot of pressure on doctors, right? We do assume that they know everything all the time, right? But they don't. They're...
The world of medical knowledge is so vast now that it's hard to keep up with the changes. So for sure, people themselves are much more informed and educated. They're using the internet, they're using social media to get their knowledge, and some of it is very valid,
like this channel,
and some of it is some of it you want to be careful of where it's coming from, and
not like this channel.
So you've got those factors to bring in for sure, and the doctor themselves, especially a family doctor who deals with everything, it's just impossible to keep abreast of all the new technology and updates going on.
But a good family doctor would take that information, do some research, and then come back and say, this is this or that, right? Good, bad, or otherwise.
Exactly. They may not be able to give you an answer on the spot, but they can go away. They can basically do research in places which are ratified and certified rather than just Google Doc, and come back to you with an answer.
Okay.
But it's just important that they know that you're taking supplement A at this dose, and it may come back that the knowledge is, that has a big effect.
Well, it's that cycle, right? So we become, as patients or as individuals, we become more informed, and then we want that self-care, which we have every right to have, and we need to have, right? But then we have to inform our care team of the self-care strategies that we're taking, whether it's lifestyle, whether it's supplements, vitamins, whatever the case is, so that our care team can have a wider view of us as individuals and not just give us canned responses or limited responses, right? So while we are taking that responsibility to exercise self-care, I think the other aspect of it is sometimes we forget that we have to inform our doctors. Now, we can get into a whole debate as to, how much time do doctors have in order to actually, get informed on each individual. And a lot of doctors struggle from, a lack of time, right? Whether it's 15, 20 minutes per patient and they have to see 24 or 28 patients. But that's where having access to that data and providing that data to the doctor to be able to make sure that they know that information, or as much of the information as they possibly can. I think that's the point here.
Yeah.
All right, fantastic. What are the investigations that we can do to find out the causes of low blood pressure?
So you're talking as with a doctor?
Yeah.
I mean,
exactly.
So obviously you'd go to a doctor if you had these symptoms. If you have measured your blood pressure, you might know that your blood pressure is low. Obviously, as I said, first off, if you don't know that and you come with these symptoms, they should be checking your blood pressure.
Okay.
So we've got you with a low blood pressure, and now we want to find the cause. And so the first basic things that they would be doing is things like your blood sample. So they will ask for a fasting blood sample normally, where you haven't eaten, so that they can do a whole barrage of tests on your bloods, related to your cardiovascular system, related to things like your sodium, your potassium levels, your blood counts, make sure you're not anemic, as I've said before. Looking at your white blood cells to make sure you haven't got an infection going on, which is what we mentioned also. So there are a number of things, your kidney function, liver function, thyroid function we mentioned. Those are the kind of blood tests that will be a set standard.
So is that different from the CBC, which is a complete blood count? Because I've seen that on my blood test where they put CBC, and I've seen, a whole bunch of things. Is that different, or is that an add-on, whether it's thyroid and all of these other?
Yeah, CBC just looks at the blood cells, your hemoglobin levels, the size of the cells, different parameters to do with the actual blood cells and content, basically what your blood is carrying around in a cellular form.
Okay.
Those other tests I mentioned are not part of the CBC.
So those are the add-ons that you would have?
Yeah, the thyroid function, the liver function, the kidney function. They're
electrolyte levels.
Yeah, they're all separate. Different parts of the world use different acronyms and different shortening names for them. So, but typically they will cover most of those things.
Okay, so that covers blood tests. Any other investigations that doctors do?
So the initial stage, again, depending on the symptoms, but you'll be looking at things to do with your heart. So you want to check your heart with an ECG, which is where they stick all the stickers on your heart, to see, is there any arrhythmias? Is it beating regularly? Is there any of these palpitations happening? Now that can be done in the doctor's office at that time. And then there is a longer term version of that where you wear it for 24, 48, 72 hours. And it's a machine that you wear with less stickers on you, but they're still attached to you.
I just want to say, with the advent of, the level of technology and with medicine going in the way that it's gone, is there no other way than those stickers? Because it hurts to take them off.
Well, yeah, and with a hairy chest, for sure, it can be painful.
Yes, it is painful. It reminds me of that the 40-year-old virgin when he was taking off when he was waxing. That was painful. It's not as painful, but I feel it. Like whenever I go in, like this is it.
Yeah, it is, unfortunately. But I mean, even with a man with a very hairy chest, sometimes they have to shave the area to get the stickers to stick. And to get a proper contact with the skin. So it's important, unfortunately. There isn't yet a method that that can really find the same level of detail. You have things like your wearable watches, like Apple Watch, which does do a rudimentary ECG, and it can pick up on some abnormalities. But I would never say it is a replacement for the full ECG. And as I said, the 24-hour or longer ECG that you take home has less stickers. It gives slightly less information, but it's pretty accurate. And that's just if you're having these arrhythmias, in very infrequent times, and also your low blood pressure symptoms might only come once a day or something. So when you're in the doctor's office,
chances are it's not going to show
be
up.
Right there.
I have low blood pressure, doctor, 135/90, right?
So this is why that can sometimes happen, and you need to have that done. The other thing, some doctors' offices, or at least hospitals, will have echocardiogram, which is the echo as you know it. And that's an ultrasound of the heart, and that's looking at the strength of the beat of your heart, how much volume is pushed out each time you beat, looking at the muscle structure of your heart, and looking at the valves. So if there's any valve problems, which can lead to other issues with blood pressure.
What's a tilt table?
Tilt table is it's one that's only used really at specialist centers, cardiologists really, and one with neurology and cardiology at the hospital. And this is literally a kind of medical table which you lay on, and you are monitored while you're having that, and you're put in different positions, tilted head down, tilted feet down, tilted to the side. It's not as
like a Middle Ages torture machine.
Not as torturous as it sounds. But I wouldn't say it was enjoyable.
Hold on, it's not as torturous as it sounds. Let's ask the question. Have you been on one?
I've not. No.
So you have no idea how torturous it sounds.
But yeah, it's something which might stimulate the symptoms, and that's why they're doing it, to see if putting you, tilting you head up suddenly brings on your low blood pressure, brings on arrhythmias or anything like that, they can tell.
So it's really just a way to try to recreate the condition by which your blood pressure would react. And by doing that, then they can see how bad it is or how extreme it is. Is that it?
It is really, yeah. It's also because there are other causes for your dizziness. It doesn't have to be a low blood pressure. So you're basically trying to see the wood for the trees and make sure that you're not being diagnosed with something when actually it's a neurological problem that's causing it, and therefore you need to actually stimulate the effects.
Okay, so outside of the torture tilt table test, is there anything else that you do as investigations?
So along with the 24-hour ECG that I mentioned, which is called a Holter, you could have a 24-hour blood pressure monitor as well. So this is having the blood pressure monitor on you, and it's attached to your belt or whatever, and it's constantly going up every. They set different parameters, but let's say every quarter of an hour it measures your blood pressure while you're awake, while you're sleeping. Obviously, you have to take it off when you're showering or bathing and things, but the majority of the time you are having this 24-hour collection. Obviously, you can do this yourself with your own machine and do it every half an hour or so and get your own 24-hour, but you'll need to be then sitting down and doing, as I described earlier, how to take the blood pressure. So you won't actually be doing your normal activities, should we say.
Right.
So, and definitely while you're asleep, you won't be doing it, because unless you have your night nurse, you will...
My night nurse will be asleep too.
That's a different thing for you, Patrick. Yeah. So
this is what happens when you go and you take a dig at your doctor. He's going to come back and give you a dig right back. Anyway.
And then you have things like stress testing your heart. So going on a treadmill.
Yeah.
This is also something also where you will be monitored while you do it and pick up any variation in your heart beat, and sometimes you can have a stress echo, where they're doing an ultrasound at the same time you're stressing your heart, because that can change things. So,
my God, that can get extreme.
Yeah.
Anything else, or
that's about it, really? Yeah.
Okay, well, it's a lot actually. Mm-hmm. So all of those investigations are things that you do at clinic, hospital, or with your doctor.
They're not necessarily all done
there, but you initiate it there, and then you can go.
They're not all done like in the first gambit.
Yeah,
you might get the blood tests and the ECGs done first, and gradually. It depends on how serious the situation is, how symptomatic you are, and even the symptoms you're having can point in certain directions.
Okay. So what about self-care and medical treatments for low blood pressure? So now we've identified the issue. We know we have low blood pressure. Is there anything that we can do from a self-care standpoint and anything we can do from a medication, if necessary, standpoint?
So if you've had everything checked out and there's no underlying problem picked up, whether it's with your heart, with your hormones, any of your bodily functions, they're all running normal, but still you have low or lowish blood pressure, which you are feeling the symptoms from, then self-care is very important. And the first one would be, we mentioned before, dehydration. So the first one would be stay hydrated, okay, and have plenty of fluid in the day, especially if you're exercising or in hot climate, okay. The other thing would be that eating smaller meals, actually, some people will have lower blood pressure straight after a meal.
Okay.
And so if you have a large meal, you have a lot of blood volume going to digest that meal, and it puts extra strain on someone who has a low blood pressure already. So I don't know about you, but if I have a large meal, all I want to do is go and lie down and sleep.
For sure.
And again, it's a bit of the body's self-regulation where it's saying, okay, I want you to rest here because I want to send blood to digest this meal. And I don't want you having a lot of activity, so you can your blood pressure can drop because of that.
And anyway, having a smaller meal, although more frequently, is actually good anyway for the body.
It is, yeah, exactly. For these reasons as well, you don't have extremes, so you don't have a sudden rush of glucose in your blood if you're having a smaller, more regular meals and things. So it's good for many medical reasons.
Now, this might be counterintuitive, but when I'm trying to take care of my hypertension, I'm told to eat a low sodium diet.
Yeah.
When you are in the hypo state, what is the recommendation regarding sodium on that, or salt at that stage?
So in the same way with lowering blood pressure, you reduce your sodium chloride salt in your diet because it raises blood pressure.
Yeah.
So when you have a low blood pressure, you want to raise that blood pressure. So therefore, the opposite's going to happen. You're going to be informed or advised, if you're not already taking any sodium chloride salt in your diet, to add a little bit more to your meals. And if you're being very careful with your diet and you're not having lots of processed food, which already has a lot of salt in it,
sure,
then you're not going to do yourself any harm by just increasing that slightly when you have a low blood pressure.
Right. But the point is, don't take it as an invitation to eat junk food because it's higher sodium intake, right? No. It has to be something where it's within, eat well, live well, increase the level of salt if you've got low blood pressure, but in a healthy way.
Yeah, and it needs to be done under the advice of your doctor because they will have checked you out by that point to make sure that you can have a slightly higher level of sodium salt in your diet. Whereas if there's an underlying reason for it, just adding salt might actually make things worse.
Okay. Anything else in terms of self-care?
So we mentioned also exercising, but increasing your exercising, increasing your movement, but not to the extremes. If you are just sedentary and sitting at home all the time, in the long term, you're going to become unhealthy and have high blood pressure. But if you suffer with low blood pressure, it's not going to help it. So increasing your exercise, increasing your movement will elevate your blood pressure to a better level. Again, not going to the extreme, which can do the opposite.
Okay.
So that's important. Other factors are things like they're not particularly attractive, but sometimes people have to wear compression stockings on their legs. And this...
No, they are not attractive at all, but anyway.
But these under pants, under your trousers, they basically help to squeeze your leg tissues, your muscles and your soft tissues there, to get the blood back from your feet and legs up to the heart. Because with gravity and during the day, walking around, standing a long time, even sitting a long time, fluid pools in your legs, and so this reduces your your blood flow back to the heart, which in turn reduces, you can reduce your blood pressure in some certain circumstances.
So because I mean, we all know taking compression stockings or compression socks, usually we do that when we're traveling.
Yeah.
Right? So here what you're saying is, expand it. If you've got low blood pressure, do you have to wear it every day, once in a while? Like how often or little would you do it?
So
if as necessary?
Probably as necessary, depending on your symptoms. But I think if you are suffering with the low blood pressure, you should probably wear them every day. You just need to remove them at night because you're lying down, you don't need them at night.
Yeah.
But if you are going to be upright, standing a long time, and it depends on your day also. If you are lying down at the beach, you don't need to have compression stockings on. It's not going to be something you're going to want.
I've seen it happen.
but yeah, if you're working, if you're busy and it fits, then to wear them.
Okay. What about any medication that you have to take? I understand with low blood pressure, usually that's less of a factor, but it's a lot easier to get hypertension meds than hypotension meds. But yeah, is there any that are out there? And obviously, this is not diagnosis, not a consultation, but I'm just curious to know if there's anything that people can take.
So a doctor might prescribe, there's a couple of medications that can actually help to increase blood pressure.
Okay.
But this is after careful consideration and necessity, because they often will have side effects which are sometimes hard to tolerate. But if the side effects are less inconvenient than the symptoms of having the low blood pressure, or the dangers of having the low blood pressure, then patients will sometimes opt to go on these medications. So that would be, under supervision.
Right. So that you definitely have to go and see a doctor for. But that also is a great transition into, so what are the long-term effects of low blood pressure? Are there long-term effects?
So the immediate effects can happen, which can cause long-term effects.
Sure.
So if you were to fall during a low blood pressure period because of dizziness or fainting, hitting your head, could have catastrophic long-term effects, if not life-threatening effects. So there are these kind of more traumatic kind of instances. But low blood pressure on the whole is healthier than high blood pressure in the long. But persistent low blood pressure, as in underneath that 90-60, it can lead to things like problems with your organs, whether that be things like with your brain, to do with neurodegeneration, where the brain hasn't had enough oxygen over a long period of time. There is some evidence that it could increase memory problems and even lead to vascular dementia, or be part of the cause of vascular dementia and in your old age. So you've got problems with that. You've then got things like your kidney function. So if you have a chronic low blood pressure, your kidneys don't function as well. And this can also lead to longer term problems with your kidney. Yeah. And losing the good stuff that you're not meant to and keeping the bad stuff in, which is your kidneys are supposed to be removing and filtering out. Yeah. The other thing is your heart. So a low blood pressure in normal heart, you need blood pressure to serve that heart. So you need oxygen to that heart.
So you could end up with
a heart problem. Yeah.
Just like you could end up with heart problems from high blood pressure.
Yeah. So it's also a chicken and the egg scenario. You can have low blood pressure because of a heart problem. Yeah. But if you have low blood pressure for another problem and it is consistently low, you can then end up having heart problems on top. So that's another reason.
So all of these are physiological. Are there any psychological effects?
Touched a little bit on the brain. Now that obviously can have problems with concentration, as we stated, and that can be a long-term effect. But also it can raise things like your anxiety. Sure. And this is really because you might be anxious about the effects of and the symptoms of low blood pressure, like dizziness, like passing out. Yeah. So you might
be wondering when will it hit? Like will it hit when I'm driving? Like we have a friend in common who suffers from this, and she's never fully at ease. You can almost see, like, if we say, let's go on vacation or let's do this event, it's almost like she has to kind of, take a step back and see, is this something that she can do?
Yeah.
And we found out not too long ago that she's been suffering from low blood pressure. So I never really thought of the psychological effects of that, but those could be some of those symptoms, right?
Yeah, and then these are secondary psychological, so they're kind of like an impact, if you like, of having low blood pressure, not just purely from the direct effect of low blood pressure. Alongside that, if you're missing out on things, you might get depressed and low mood because it's having a massive impact on your lifestyle and what you can do or what you feel you can do. And this is where, that's why it's important to get help and to get it early, so that if there is an underlying cause that can be dealt with, then you can go back to your normal life and enjoy things. So, and anxiety can, be helped. And then the general effects of having your blood pressure increase, whether that be reducing your cardiovascular risks, reducing your general health risks as well. Blood flow is really important for the body, fighting infection, reducing aging, helping all of these effects. So that again is important.
So that kind of gets you to, probably as we're now docking our boat, to the benefits of better management of low blood pressure is that you do get better cardiovascular health, you do have reduced risk of heart disease, you have an improved quality of life. I don't want to steal your thunder here, but it seems like managing your low blood pressure, because of the symptoms that you get, you are a little bit more aware than you would be on the high blood pressure side. So by managing those, you can actually see a tangible effect on your life.
Absolutely, yeah. I think that makes it more encouraging to persist with these treatments and these self-care things, because it can have massive effects on the quality of life just by doing a few minor things. Unlike high blood pressure, you don't see those effects necessarily straight away.
So you don't know what the problem is, and if you don't know what the problem is, how are you going to solve it?
Yeah. No, true. And even if you do know the problem, we all know that sticking to a new routine is difficult. And if you can't feel or see those symptoms, you fall off the wagon, shall we say, very easily. But with low blood pressure, you put all these things into your lifestyle, you will find that you're reducing your symptoms, and therefore increasing. You will notice it, and your quality of life will notice it.
Yeah. All right, fantastic. So any last words of wisdom you want to impart onto our viewers and our listeners regarding low blood pressure?
So low blood pressure, as we said, it's a significant problem because of those symptoms, and it does affect a large number of people. It's in the shadow of high blood pressure as far as publicity, but it's a problem which it can be dealt with and helped through all these techniques we've discussed. But it's so important to have early recognition, to increase your quality of life and to reduce your long-term risks of what we've discussed. Being proactive is the key in all of these things, in any health issue. If you sort it out early, you're going to find that it's a much easier task than if you leave it too late and the damage is done.
Like anything else in life, right?
Yeah.
All right, fantastic. So on that note, first of all, thank you very much. That was extremely informative, and just opens your mind to the fact that just one aspect of blood pressure that you have to look out for. It's actually on both the hyper and hypo standpoint. So as we said before, and I will repeat it again, please do not take any of the information that we've provided as a medical diagnosis or a consultation. This is just for general information purposes. If you feel any symptoms or anything that we've discussed, please do go and see your physician, your doctor, your care team, and make sure that you get these things covered. If you've enjoyed this podcast, as I hope you did, please like and subscribe. And if you've got any questions or anything, leave them in the comment section below, and we'll get back to them as soon as we can. Thank you and take care.